Today I have another microneedling video for you. So many of you have asked me if I have tried or to please try the new Dr. Pen. I just got mine in the mail. This is the new Biopen Q2. Like I said, I just got this in the mail, so I have not tried it. And in today's video, I will try this for the first time with you. I have of course taken it out of the box and charged it, but that's all I have done. Now really briefly, if you're new to microneedling, in this particular video, I won't go into too much detail about what microneedling is, the different types, what to do and what not to do. I will show you a full treatment with this pen. It will be a first impressions video, but if you're curious about microneedling, I have a whole playlist on microneedling, which I will link down below in the info box. Now this Dr. Pen looks quite different from regular Dr. Pens. And that is because this combines 3 different technologies in one device: microneedling, EMS electroporation, and LED light therapy. And I will read you just a bit of what they say on the website. They say that the key benefits from using the Biopen Q2 are improved skin texture, reduced lines and wrinkles, which is of course due to microneedling stimulating collagen production. We already know about that. But they go on to say that the EMS electroporation strengthens skin elasticity, providing a firmer, lifted appearance and minimized pore size. And that the LED light therapy reduces redness and inflammation and accelerates healing, which we know to be true about LED light therapy. Now about the EMS electroporation, they say that this uses 3 levels EMS electroporation, featuring 25 pulse EMS microcurrent. They go on to say that this device delivers stable and average energy, stimulating cells in a 3-dimensional manner. The ingenious arrangement of positive and negative poles create a dense microcurrent energy field, enhancing skin texture and firmness. And then lastly, this pen uses red as well as blue LED light therapy. And the wavelength is 470 nanometers for blue, and the red light is 630 nanometers. Now, while I am a huge fan of LED light therapy or red light therapy, I don't know, having this pen in contact with my skin for just seconds in each spot, how much the LED light therapy is really going to do. But I will pop on tomorrow and we can see if my skin maybe did heal faster than it normally does when I do microneedling. Now I'm very familiar with LED light therapy. I'm very familiar with microneedling, but I am not familiar with EMS electroporation. But doing a quick Google search, I learned that electroporation is a non-invasive skin therapy that uses electrical pulses to temporarily split open skin cells, allowing products to penetrate the skin without needles. So basically, electroporation is a non-invasive form of mesotherapy. And I find it interesting that they chose to pair it with microneedling. But let's try this pen together and see what happens. Now, first of all, what I like about this pen is that it comes with this little stand right here. So supposedly, let's try this actually. When the pen is on, so you turn it on right here and you rest it in here, it pauses, and it actually does. I like that. So let's turn it back off until I have my cartridges on. So this I like because sometimes I want to put my pen down and I can just rest it on here and it actually pauses. Now the pen comes just in this box right here, and it does come with 2 25-pin cartridges. And the 25-pin cartridges are really more for cosmetic or shallow needling. These are the 25-pin cartridges, and you can probably not see much, but you can see that these cartridges are quite different. They are a bit more expensive than the regular Dr. Pen cartridges. I forgot how much, but I will put everything down below in the info box. So this pen comes with this stand a charger, of course, and then two 25-pin cartridges, which again, I personally would use for cosmetic or more shallow needling. So since I want to do medical microneedling today, I want to go a bit deeper. I did order some 9-pin cartridges, which I have right here. And I also ordered some 14-pin cartridges. And I think I'm going to start with the 9 and see how that goes. And I might change my mind and go to the 14. So the 9, of course, will penetrate deeper. The way you can think about that is if you step on one single nail with your bare feet, right? That nail is going to go straight into your foot. If you step on a bed of nails, it might hurt, but those nails won't really penetrate. So while, of course, I will set the depth of penetration on my Dr. Pen, having fewer needles will still make a difference, or having a cartridge with fewer needles will still make a difference. I hope that makes sense. Like I said, I have a whole playlist on microneedling where I go into detail about all of these things. So if you're new to microneedling, please check it out. Let's see. My face is completely clean. My face, neck, and chest. I probably won't do my chest today, but my face and neck are completely clean. I double cleansed. I have nothing on my skin. I do have a bit of lip balm on my lips because my lips were quite dry. But once I get to around my lips, I will wipe that off because, of course, I don't want to needle that into my skin. Personally, I don't ever use numbing cream. Now, I don't know how painful this guy is, we will find out. But personally, I don't ever use numbing cream. However, there's nothing wrong with using numbing cream. Everybody has a different pain tolerance. But if one uses numbing cream, you want to really make sure to wash it off completely because you don't want to needle the numbing cream into your skin. Now, I have started doing a stamping technique. So technically, I don't need to put anything on my skin because I don't need this to slide around on my skin. But I like to use things on my skin to just enhance collagen production. And I get asked so often, what can I use with medical microneedling? I ordered a bunch of products. Some of them I have tried. The Dexacel I have tried. This is a copper peptide product. This is one I've tried before too and just loved. This is human stem cell conditioned media. I have one for around the lips. And this I'm actually excited about because this is PLLA. And if you've been here for a little while, you know that I had biostimulators. I had Sculptra and also Landuma. Both of those are PLLA, poly-L-lactic acid. Now, they are injected into the skin, deep into the skin. This is not going to be injected. This is just going to be microneedled. But this is PLLA, and it is for around the lips. I would imagine that you could use this all over your face, but it does say that this is a lip restore treatment. And then I have just a bunch of little vials that are different treatments that can be used for or with medical microneedling. I will link all of these down below. I think today I am actually going to use the human stem cell conditioned media. I have used this once and I really loved it, so I'm excited to use this again. Now this does come in a syringe which does not have a needle. And this is a lot of product. So when I used this last, I used this actually for 2 treatments. I used half of this and put the other half in the fridge and used it 5 or 6 weeks later. So I am going to do the same, I think, today. And I have a clean dish right here, which I cleaned with alcohol. I also do have some alcohol right here in case I need it for something. I have some cotton swabs so I can put the alcohol on and clean my hands or something. So what I'm going to do is I'm going to put half of this in here right now. And then I have a brush, which I also cleaned with alcohol. I will apply that with the brush and then we will get started. So I just had a little accident. I went a little too crazy opening up the package. If you order this, like I said, this is amazing. The package is a little bit difficult to open. This didn't happen to me the first time around, but this time I think I was in a rush because I'm filming. I opened this and the syringe pulled apart. half of it went onto my leg and my chair, which is a real bummer because this is like liquid gold. So unfortunately, I only have a little bit in here, not enough for 2 treatments, that's for sure. I hope it's enough for 1 treatment. If not, I have plenty of other things to play with right here. So, like I said, I'm going to use a 9-pin cartridge. And of course, these come individually packed and they are sterile. And these look quite different than the regular Dr. Pin cartridges. So, and this is what the cartridge looks like. I'm going to, as I said, I have not tried this pen, so there might be some trial and error. So I'm going to take this cap off, and then there are 2 small holes. I don't know if you can see those. And this has 2 poles. So we're going to stick that in there and then make sure it's nice and tight. Now I hope that you can hear me okay. I got a new microphone because, oh, by the way, if you're wondering about the new background, Sam and I just arrived. There's really not much in here, unfortunately. Sam and I just arrived in San Diego about, I think we've been here for 10 days now. So this is our condo in San Diego. My husband is now in Africa. It was a very sad goodbye, but luckily I can talk to him every day via FaceTime. So this is already not enough. I think I'm going to open something else up. I'm really bummed about that because this is so amazing. I will definitely reorder it and then next time be more careful. So I think I'm just going to go with this one right here. This is a multi-peptide serum, and hopefully I can just open it like this. I do have a syringe right here just in case. Yeah, I do need a syringe. So if you order little vials like this, it's always a good idea to have a syringe. I get these on Amazon and I basically just use these for these kind of things. So I'm going to put a bit of air in here and then pull this up. And then I'm just going to take the needle off, put that into my little pot, and we go from here. All right, so I was saying I have a new microphone and hopefully it works okay. Hopefully I'm not bumping into it too much. But the reason I needed to get a new microphone is that where I'm filming now, I'm getting this all over me, but that's okay. Where I'm filming now is right in front of a window, which is beautiful. It's nice light, but there's a street train right in front of the window that comes by probably at least every minute. And so I really needed something to cancel out the background noise, and I hope it's doing that. Let me know in the comments. All right, let's get started. So the bottom button turns it on and also changes the speed. So I'm going to go to a 4. Hope you can see that. It is on a 4. Then the second button is the EMS electroporation. I'm going to put that on the highest level and see how it goes. And then lastly, right now it is on blue LED and I want it to be on red. And then this pen, interestingly, only goes to 1.5 millimeters deep, which is plenty, but most Dr. pens go to 2.5 millimeters. So I have this set right now on 1 millimeter. I might change my mind, but that is what I'm going to start with right now. Oh, this thing is so sensitive. So I just touched it accidentally and it turned off. So lesson learned. Let's start again. I'm going to turn it on. Level 4. We are going to do the highest level on the EMS and red LED. Okay, I'm a little bit nervous. Let's see. Okay. So this is how I usually start. I start at my jawline, and this is interesting, and then I go all the way up. Now I do have a mirror right here, so if I don't look at you, I'm sorry. I just want to make sure what I'm doing. But I don't know if you can see this. So when I press right here, you can see that my cheek is twitching. That is from the EMS electroporation. Now, to be honest, I don't know how much benefit I'm going to get from these two added treatments, the LED light therapy and the EMS, just by having this in contact with my skin for this very short amount. But we will see. I will come back on camera tomorrow and we will see. It's so interesting how it twitches. We will see if I got maybe faster healing or if anything is different. So I'm just going to keep going along here along my jawline. It is awkward to talk to you with this twitching, and this is going to take a while because this surface is even smaller. I wish I had a regular cartridge right here, a regular doctor cartridge. I will put a little picture right here. That one is about, the surface is about this big. This one I would say is about half that big. So it's going to take me longer to cover my whole face, but I'm just going to keep going. As far as pain, I'm sorry, that twitching is just so awkward. I just hit my microphone. I hope that wasn't annoying. As far as pain, it is not any more painful, right now at least, than a regular doctor pen going at 1 millimeter. So again, I'm using a 9-pin cartridge and I'm going at 1 millimeter right now. The reason I like to go 1 millimeter on my cheeks is that I do, I'm not as sunken in as I used to be, but I'm still a bit more sunken in, and I do feel it is harder to get to where I want to get to. I will go less on my forehead and even less around my eyes. But I will probably put this on fast forward right now, unless something really exciting happens, and then when I get to the other areas, I will talk to you again. I'm going to try to turn down the EMS just to see if it's still, I'm going to put it on level 1, if it still twitches like that. Now the twitching it's not a big deal, I'm just curious if it's still, okay, so on a level 1, I don't get that twitching. But I am going to put it back on a level 3 because I do want to see what happens, if there is any extra benefit of having this added technology. Oh, for some reason it's really sensitive right here as I'm getting closer to my nose, which, I don't normally experience that. I wonder if it's because of the EMS. Let's turn it down and see what happens. Yeah, it's definitely that. So for some reason that intensifies the pain a little bit, but I'm going to tough it out for you because I do want to see what happens. But that definitely, that's interesting. Oh, that definitely intensifies the pain a little bit. Not out here, but as I'm getting closer to my nose. All right, so I have covered this side vertically pretty well. Now I'm going to go, horizontally pretty well. Now I'm going to go vertically. You can see I did not go past the orbital bone. I will go closer to my eye, but I will turn down or go less deep. It's hard to think with all this twitching and everything going on. So I'm going to do the same thing. What I try to do is put the pen right next to where I treated before, and then I work my way back up, trying to not overlap too much, but to cover the whole area. So again, out here, I don't find it any more painful than usually with a regular doctor pen at 1 millimeter depth. But as I get closer to my nose, probably because there's a bit less fat, a bit less tissue, it definitely gets more sensitive. And you can see I'm getting some nice erythema However, I don't really have any pinpoint bleeding, which is interesting. Usually at 1 millimeter depth, I do get a bit of pinpoint bleeding. So that is interesting that I haven't gotten any pinpoint bleeding. It's just as I'm getting closer to right here for some reason. Oh, you can see it's making my eyes tear and I have to sneeze. Oh. All right, so this area is done. I am going to actually let this rest for a second. I do like that I can put it on the stand and it just pauses without having to turn it off and start all over again. So I'm going to apply a little bit more of this so that it can sink in. And again, I'm getting this all over myself because this is quite watery. And then go to this side, and I'm dripping all over the place. Go to this side, and I'm going to do the exact same thing, put it on fast forward so I don't bore you. So as soon as I pick it up from the stand, it starts again. So I do think this is a nice feature that it comes with this stand and you can pause it. Again, same thing on this side. It does get really sensitive as I'm getting closer to my nose because of the EMS. So I have covered both cheeks. Again, I'm going to take a bit of this and apply it on top so it can sink in nicely. And again, I have 0 pinpoint bleeding, which I find quite interesting. I don't know why that is. I don't know if it has to do with the added technologies. I cannot doubt it. But it is curious. Okay, now I'm going to do the worst part, which is around the mouth and my chin. I am going to try to stay at 1 millimeter because I really would like to work on all the lip lines I have developed. It might be a bit too painful with the EMS, we'll see. So far so good on the chin. I spoke too soon. The EMS definitely makes it more bitey. Just out of curiosity, let's turn it off, see what happens. Yeah, definitely. It does add a little extra level of discomfort with the EMS. But again, I'm going to tough it out for you on the highest level to see what happens. It just adds a little extra zing to it. Hopefully it's worth it. And now I'm actually going to rest this for a second and wipe off my lips because I'm getting close to my lips and I don't want to, by any chance, even though the lip balm is on my lips, I don't want to risk it and needle that into my skin. So I took a bit of alcohol and I'm going to wipe that off, and my dry lips are not going to like that, but better safe than sorry. All right, let's continue. Okay, I'm going down vertically. Now this is just how I like to do it. You can do whatever you want to do. I find that with the stamping technique, I get better results, and it makes more sense to me than sliding the pen along the skin, even if I have slip. It just seems there's a risk of micro tears. So stamping, while it is a bit tedious and it takes longer, I do this once a month, once every 6 weeks. It's okay that it takes a bit longer. It's worth it for me to have a safer, more effective treatment. And this is how I like to do it. I like to go horizontally and vertically, but you do you. Okay, I'm going to go close to the lips, and interestingly, this is not bad. I mean, it's not pleasant either, but it's not any worse. The addition of the EMS is not, at least around the lower lips, making it worse. Let's see what happens at the top. Okay, not too pleasant, but also not too bad. This is always the worst part to me, around the lips. And this is again where I would like to see some nice results, because I'm definitely developing quite a bit of lip lines. I'm going to turn the EMS off just out of curiosity. Yeah, it's a tiny bit less uncomfortable without the EMS, but I can handle it. So I'm not going on my lips, but I'm going very close to the vermilion border because I do want to, again, really try to improve those lip lines. Okay, forehead. I am going to go less deep on the forehead. Now, one nice thing that they did with this pen is you can read the numbers a lot easier. You can see my nose is starting to run. You can read the numbers a lot easier. So I'm going to put this on 0.5 for my forehead, applying my serum so it can sink in here, and also a bit to my forehead. Aside from the lips, the forehead is usually not that pleasant either, but 0.5 isn't too bad. And you can see my eyebrow jumping around from the EMS. Oh, that definitely adds a bite to it. On the forehead, the EMS, let me see without it. Oh yeah, big difference. So without it, interestingly, my forehead is still twitching. Without it, definitely less discomfort, but again, I'm going to tough it out for you. And I forgot if I already mentioned that I'm not applying a lot of pressure. I'm placing the pen, and then of course the needles just jut out, so I don't have to help the pen out much. I don't have to press like crazy. I'm just applying slight pressure. Okay, my face is done, aside from under my eyes. Now what I'm going to do is I'm going to wipe my hands. Obviously, I washed my hands before I started this treatment, but just in case, I want to just make sure that my hands are completely clean, because I am going to use 2 fingers just to slightly pull down the skin under my eyes so I get a bit closer to the lash line, because when we microneedle under the eyes, we don't want to get past the orbital bone. But by doing that, it allows me to get just a bit closer to the lash line without actually going past the orbital bone. But before I do that, I'm just going to apply a bit more of this on my forehead. And then I'm also going to put it under my eyes. Now for the eyes, I am going to go even less deep. I'm going to go 0.25. And I'm going to look in the mirror just to not poke my eye out. I'm going to put one finger right here at the corner, the other one at the other corner of my eye. Pull that down very gently. And again, that allows me, so I'm still staying outside the orbital bone, but that just allows me to get a bit closer to my lash line. Now this cartridge, while the actual needle surface is quite small, the cartridge is a bit bulky, so it is a bit more challenging because I'm bumping into my eyelashes, but it is possible. And again, I'm just going 0.25 right here. The skin under the eyes is very thin and delicate, so while of course I want to treat it, I don't want to go too crazy. Alright, so you can see I got closer to the lash line now. I have more erythema right here by the lash line compared to this eye, so I'm going to do the same thing on this side, gently pulling down. Alright, I'm done. Now as you can see, I have some nice erythema, some nice redness everywhere, but what I find interesting is that I have 0 pinpoint bleeding. And as I said, I went 1 millimeter deep on my cheeks and around my mouth and my chin, 0.5 on my forehead, 0.25 under my eyes. But usually, let me put something on my lips. My lips are so dry I can barely talk. But usually, when I go 1 millimeter deep, I definitely, especially around the lips and my chin, I usually get pinpoint bleeding. Now, pinpoint bleeding is not necessary to get a good treatment. But I find it interesting that I didn't get any pinpoint bleeding. Who knows if that is because of the other technologies in this pen? Who knows? But as far as discomfort, the EMS definitely adds a bit of a bite, especially in certain areas. Now, it is not unbearable, you saw me do it, but it's definitely a bit more painful. So if you're sensitive, you might want to play around with the EMS at a lower level, leaving it away, whatever you think is best. Now, I was thinking I would also do my neck and my chest, but I'm actually going to do that in a few days. Sometimes I think treating such a large area is a lot to heal for the body, and I'm just going to wait a few days and then do my neck and my chest. Now, I will probably come back on camera tomorrow if there is a huge improvement. Or I'll just come back on camera and we'll see if there's an improvement. And I can maybe put a picture of another treatment I did with a different Dr. pen at 1 millimeter, and the day after see if there is a difference, if indeed the LED light therapy in here is going to help. Now, what I usually do after microneedling, after medical microneedling, is I use LED light therapy, and that definitely brings down the redness. I'm not going to do that this time because I want to see if just the LED in here, and turn back on, I haven't turned it off, if just the LED in here is actually going to make a difference. So like I said, I'll pop back in tomorrow and we can decide, is the LED making a difference as far as healing it? I think as far as the EMS, that's going to be something we will see in the long run if it does make a difference. I'm a bit skeptical because, again, the pen is in contact with my skin in each spot for just a few seconds. Now, microneedling, of course, I get these needles to penetrate, that is going to do something. But the LED light therapy being there for a couple of seconds, the EMS being there for a couple of seconds, though it did go through my whole face, you saw it twitch, but still I'm skeptical, but time will tell. It is the next morning. It has been about 14 hours since I medical microneedled with the new Biopen Q2, and I have to say I am actually quite amazed at the lack of redness I have. I'm going to come a bit closer. As you can see, my forehead and my cheeks look completely normal. I do have a bit of redness around my lips, and that is because once I finished my treatment and finished filming, I got really curious about the PLLA lip treatment, and I applied some of it around my lips, turned my pen on, and went over that area again. It is not something I recommend. It is not something I normally do. Normally, when I'm done with an area, I don't go over it again. So again, not something I recommend, but my curiosity got the best of me. But aside from that redness around my lips, the rest of my skin, to me, looks completely normal. I do have some roughness and dryness, like I normally get after medical microneedle, but I actually looked at this video right here, which I filmed about 1.5 years ago when my friend Tamra came to visit me in Paris, and her and I did a medical microneedling treatment together. Tamra went 0.5 millimeters deep, and I again went 1 millimeter deep. And as you can see, the next day I am quite red, which is normally what I look like the next day after medical microneedling at 1 millimeter depth. Even if I microneedle at 0.5 millimeters, I am usually the next day much more red than this. So I'm not sure why there is hardly any redness. Maybe it is the addition of the LED, the EMS, who knows. I definitely like the lack of downtime because while of course I do my medical microneedling sessions quite regularly, I try to do them every 4 to 6 weeks. It is something I have to plan for because I do know that normally the next day I will be quite red, and even day 2 and 3 afterwards I will still have a bit of downtime. So it is something I have to plan for normally. But today, if I wouldn't have gone crazy around my lips, I could go out, nobody would know that I did anything. So it could be a complete fluke, I don't know, or it could be the addition of the LED and EMS. I will continue to use this maybe 4 to 6 weeks, and I will keep you posted. But my first impression is I like this pen so far. It is easy to use. I really like this stand that I can just put it in here and it pauses. I like the addition of the LED, whether it actually does something or not, I'm not sure yet, but I like it. The EMS definitely adds a bit of a bite to the treatment, but you saw me do it. It's not unbearable, but it is definitely more uncomfortable than without it. Now, I did have it on the highest level. I could, of course, turn it down, but I wanted to see what happens. So far I like this. I will, like I said, continue to use it and keep you posted. I hope this video was helpful. I would love to know, have you tried this pen? And if so, what is your experience with it? Any questions or comments? Of course, please leave them down below. I always love to hear from you. Thank you so much for being here. Until next time, bye.